Are you from Shawlands?
Yeah. Oh,
fair you go.
We're really pleased to be working with Tommy Whitelaw from the Dementia Carers Voices campaign.
I'm Thomas.
We want to link the Leading Change Adding Value framework for nursing, midwifery and care staff to the fantastic work that Tommy's done collecting thousands of pledges from frontline staff. We know that the Leading Change Adding Value framework can support nursing, midwifery and care staff to turn those good intentions into actions. So Tommy, can you tell me why staff come to talk to you about what matters to them?
I've been given an opportunity to share a story and to share a personal story and the stories that people have shared with us as part of our work in our campaign. And I think that allows people a bit of honesty and openness and permission to share their stories. I've left some cards on the tables and it's got a couple of questions on it, and what I'd like you to think about while I'm speaking today is, why do you do this remarkable thing that you do?
And what about the pledges that you've collected? Because you've done some fantastic work and collected thousands of pledges. What made you start collecting those pledges?
Well, a couple of things actually. From starting the talks, which have kind of evolved, people would get in touch after it and tell me how they felt and what they might like to do. But also people would also share that they felt it was the first time that they felt able to speak about the job that they did and how they would like to do it or how they do it, and actually celebrate what they do. We often walk through these buildings, and these incredible buildings that are busy, and they're full of people getting up and doing so many different amazing roles that allow and support that good care to happen. But often in those environments we don't get to meet the remarkable people who are doing all those different jobs. But their work and the things that they do have resulted in that good experience and good care. So the pledge trees were a way of telling a story that no matter what your role is, you have the potential and the opportunity to transform people's lives and their experiences. And then you start reading them, you think, but I have a duty now. And that brings the next question is, well, people have to be supported in order to do that. They have to have a starting point. Having this framework now is a real important base.
So whatever their role or wherever they work, they can improve outcomes and experiences for patients.
Well, absolutely, and I think that goes back to having that foundation, because it brings the framework brings many different aspects to it. It's a place to work from, but it's also a place to work towards.
I suppose it links into the commitments, doesn't it? So the pledges could be parts of the commitments. If we think about commitment 6 and what matters to you and what matters to staff and patients, that's where your work links in here.
Everything is based on and wrapped around and founded on what matters to you. And I'm really glad to see that there's a commitment 6 in there to ask staff what matters to them. And actually surrounding that by who matters to you, I think they create a new conversation and a different relationship. That's the base point we have to start with. We have to find out what matters to staff in order to make that conversation have longevity to it.
So if you were going to give a message to nursing, midwifery and care staff about leading change, adding value, what would you tell them?
I would absolutely tell them it's about them and it's for them. It's there to support them, it's there to guide them. And if we're all working in towards the same outcomes and from these same positions, we'll feel better supported, we'll feel encouraged, we'll feel able to be that leader every day. Thank you very much. Thank you.
My pledge is to find out about the individuals I care for and find out what matters to them. This way I can always provide person-centred care.
hello, my name's Jo, and my pledge is to promote what matters to you for patients, for carers and for staff as well. Every person that walks through that door has an opportunity to lead change and add value. It was a kind of missing link for me of where do you do with the pledges and how do you support the incredible people who make them. But it's bigger than the pledges. I mean, that's the part that we play in it. It's for every single person who has made that incredible and remarkable and brave and beautiful decision that they're going to dedicate their life to caring for others. And we should be doing everything we can to make that achievable and allow them to be the new and the next and the best and the greatest leaders.